CATHIP Health Hour. The Caribbean and African Health Network, CARN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@carn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.
Hello, everyone. Can we all hear me? I hope we can. Today is one of those days where I am very, very happy. I'm very, very pleased because we are here again at the Targeted Health Hour organized by Caribbean African Health Network. And it is targeted at us. If others want to join us, fine. And when I say us, I mean Black and ethnic minority persons. For a reason. Because most times in our communities, we don't see people who look like us in some of these host countries where we find ourselves. And when I say host countries, I mean we are in migrants in the United Kingdom, Canada, United States. But I know that some people are even joining us today from Nigeria, the Caribbeans, and all over the world. And I welcome all of us. You will not be disappointed today because, as usual, we are pushing boundaries today. We are going to be talking about mental health inequalities, our roles as individuals, as people in the community, and our responsibility. We all agree with me. I mean, I am Dr. Loretta Oduwari-Ogburoko, a consultant obstetrician and gynecologist. We all agree with me that as Africans, Afro-Caribbeans, there are certain things we do not talk about. We talk about them behind closed doors, in hushed tones. However, even though mental health is one of such things, it is something that affects all of us. It is no respecter of status, class, person, individuals. So we must talk about it. And on hand today to help us throw light on this subject is no other person than a member of my own alumni, the University of Benin, from Benin. And unashamedly, I'm the president of the University of Benin Alumni in the United Kingdom. So I'm very, very happy today to be introducing to us a consultant psychiatrist, someone who will do justice to today's subject. And please get ready to put your questions in the chat. Ask her any question at all. Dr. Mosun Fapohunda. Dr. Mosun, please, you have the stage. It's yours. Dr. Mosun is a consultant psychiatrist, Herefordshire Partnership University, NHS Foundation Trust. Good morning and welcome.
Good morning, everyone. Thank you for having me and thank you for the wonderful introduction, Dr. Loretta, and thank you, Can, for the invitation. I will start by sharing my screen. I have a few slides. Do not mind if the slides seem a bit busy. I'm quite keen that we have a conversation because we don't often have time to do this. So I'll try and go through my slides very quickly, but I'll be happy to share them at the end of the presentation if you want to go back to look at them, due to the speed with which I have to share them, because I'm quite keen that we have enough time to have a chat at the end. So it's very much going to be a dialogue. So can people see my screen? Can I get a confirmation that you can see my screen, please?
I can see your screen.
Okay, so yeah.
Oh,
yeah, that's me. I work in the UK, so most of this presentation is going to be UK-based data. And we're talking about mental health today. So I'm going to I'm trying to move that on. It's not moving. Please give me 1 second. Sorry. I'll go back. I've stopped sharing. I'm just going to go back to this. Okay, so I'll start sharing again. Can people see my screen? So I'm going to share from
Yes,
here.
we can. Could you please put it on slideshow, Dr. Mosun, so we can see it larger? Thank you.
Okay, I will do in a minute. Okay, is that better? Okay.
Yes,
Can you
that's
see?
perfect. Thank you.
Okay, so let's go, folks. So, because this is a mental health presentation, obviously I have to check how you guys are doing. I hope everything's all right. If anyone's not feeling too good, please talk to somebody. Your mental health matters, and obviously we're here to end the stigma as well. So the World Health Organization defines a state health as a state of complete physical, mental, social wellness, and not just the absence of disease or infirmity, which means that your mental health matters. Your physical health also matters. So even though we're talking about mental health today, I just want to remind people, please look after your physical health as well. Know your numbers, know your organs, go for your testing, go for your call-ups, routine tests, special appointments. Just make sure you're taking your medications, you're looking after your physical health as well. Mental illness, as my introducer said earlier on, Dr. Loretta, it can affect any age groups. So young children can have mental health problems, teenagers, adults, and older adults. Please don't forget older adults, because sometimes I think we forget that they can have mental illness. And I think bereavement as well is an important factor. You'd see that sometimes when our older adults lose their partners, they become really, really depressed. And that's one of the reasons why they might die in quick succession. And I don't think we pay much attention to things like that. So bereavement, older adult dementia. That's why in mental health, we have services for young people, we have CAMS, we have services for older adults, because it affects everyone. It also affects the rich and the poor, don't forget. If we didn't affect the rich, then we won't have the high rate of suicide we have. Even in rich people, billionaires do end their lives. So that should show you that mental health does not affect only the poor people. So if we want to sort of try to address the causes of mental health, there's a huge range of causes. I'm not going to dwell on all the causes today, but I just want to highlight very salient points. Drugs and alcohol can cause mental health problems. Please let's remember that. So obviously, if people go into drugs, there's services to help you. If you've got an issue with alcohol dependence, there's services to help you. Don't forget that. Social stresses can lead to mental health problems. So if you've got a problem with your relationship, with your work, with your finances, with your children, if you're being bullied at school, if you've been abused, if you've got chronic physical health problems, it can affect your mental health. So because we're a whole human being, so it's not possible to separate our mental health from whatever else is happening around us. So there are environmental factors that can affect our mental health. I just want to point that out. And of course, there's genetic factors as well. So some mental illness would run in families. We'll say that people have genetic predisposition. Some can occur in childhood during pregnancy. That's why it's very important that we look at pregnant women look after themselves during birth and delivery, to make sure that babies are okay so that they don't suffer brain injury. It can be hormonal dysfunction, infections that mothers have during pregnancy can lead to mental illness, some medications and things like that. So I'm just touching on these things so that we're mindful of them as factors that can cause our mental health not to be as good as they can be. Obviously, hormonal imbalance. Remember, not just in pregnancy, also menarche. Teenagers might have behavioral problems because of their hormonal surge. Some women, when they're perimenopausal, menopausal, they might report some mental health problems as well because of their hormonal imbalances. So I'm just going to touch on, I'm not obviously going to deal with full diagnosis of mental illness today, but just some common ones like depression. So just highlighting to people that it's okay to feel low sometimes if things are not working well, but when you have a sustained period where you're constantly feeling low, you can't concentrate, you're losing interest in things you previously enjoyed, you don't have energy, you're tired all the time, all these factors that you're seeing on screen, changes in appetite, not sleeping, feeling low self-esteem, low mood, feeling hopeless, lack of confidence, all these things can be symptoms of depression. If they go on longer than 2 weeks, they are not normal. You should speak to somebody, try and seek support. Obviously, people can have anxiety as well, where they're shaking, they're having tremors, they're sweating all the time, palpitations. These are not normal. Some people live with chronic anxiety and they think they're normal. They're not. So if you're somebody who has, disproportionate anxiety to things, you want to go out, you're anxious in social situations, you're anxious to talk to people, anxious in exam situation, over a little bit of anxiety is good, it keeps us going, but if it's too much, then obviously seek support. Some people have what we call bipolar affective disorder, manic depressive. 1 minute they're sad, the next minute they're happy, and it's not just happy, they're excessively happy, they're loud, they feel that they have superpowers, their mood is constantly, hyperactive and things like that. Obviously, they can be distracted, they can have what we call grandiosity, and they can dress inappropriately, they can overspend, they can have inappropriate sexual behavior. All those things can be signs of mania, the high parts you get in bipolar affective disorder. The other part is the depressive bit, which I've already tried to describe. Some people would have what we call a psychotic illness, and that's moving towards the very severe end of the spectrum of mental health problems. When people have psychotic illness, they can have what we call hallucinations. They can have like delusions, like various types of hallucinations, like visual hallucinations. They can see things that other people don't see. They can sort of hear voices, auditory, tactile hallucination, olfactory. They can be paranoid. They can have delusions. They can, a lot of things can happen when people have psychotic illness. I'm just touching on all these diagnostic criteria, just to alert you that there are different range of mental illness. Again, I'm touching on them because there isn't enough time to expatiate very much on them. However, mental well-being, a medication is not always required. So we treat people based on their diagnosis and the severity of the symptoms. So if you have mild symptoms, moderate symptoms, just things like eating well, exercising, managing your stress, going for counseling can help you. You don't have to wait until things move from mild to moderate to severe before you get the support. And if you can look at the slide on this side, you can see all the things that can cause you to feel stressed that can begin to affect your mental health. If you've got financial problems, if your career is in trouble, people have chronic health conditions, cancers, even things like diabetes, stroke, hypertension can cause people to feel worried about them. Chronic pain, like arthritis, things that can cause you chronic illnesses, can cause people to feel depressed. Not just, like relationships, pressure, divorce. So there's a lot that can predispose you. But if just speaking up and seeking support can help. So if it's a mild stage, just talking to somebody, fresh air, going on a walk, exercising, eating well, some counseling can help. If it's a severe end of the spectrum, you might need medication, but it's not everybody. And just things like meditation, yoga, massage treatment, gardening, nutritional support, just doing things you enjoy, going on holiday, can make you feel better And I think sometimes we don't pay attention to things like this. On a Saturday morning, you can go for a yoga class, you can go for a dance session, you can meditate, you can have, so there's a lot that we can do to improve our mental health. However, if there's a lot that we can do to improve our mental health, I think the question is why? Why do we still not talk about our mental health? Why? So some of the things we're dealing with today is the barriers to addressing mental health issues. And Dr. Loretta spoke about stigma. You know, people still feel embarrassed. They still feel a sense of shame and reproach from having a mental health problem. And it's difficult because if you fracture your hand or your leg, or if you're bleeding, people can see it. But people don't know what's going on in your head when you have a mental health problem, which is a disorder that plays on your mind, can affect your behavior, your thinking, ability to concentrate, you know, reality. You know, so people don't know unless you speak up. There are cultural barriers as well. There's still people that don't want to marry from certain you know, cultures or certain families because they hear that, you know, they have a history of mental illness. There's religious factors. You know, sometimes religious factors can be protective. I'll talk about them later. But sometimes it can also mean that people do not present. You know, when you hold your faith and you add religion, medication and professional treatment to that, the outcome is better than if you just hold your faith. You know, whatever faith you are, you know, healing is always a significant part of our faith as well. So there's no reason why you shouldn't seek help because you're a person of faith. Environmental factors and systemic factors I would also pick up later. So there are health inequalities. So I am a consultant psychiatrist. I practice in the UK. So some of my data you see that are UK specific. There are health inequalities, of course, in the UK. When we are trying to think about the factors that might mean that people are not presenting with a mental health problem, it might be because of some of the mental health inequalities that they've heard. We're not making it up. So these slide that you're seeing is from the NHS Race and Health Observatory. It's real. So Black women, and this is not just mental health, Black women are 4 times more likely than their white counterparts to die in pregnancy. That's huge. You know, higher rates of deaths in children. Black and African Caribbean people are 4 times more likely to be subjected to community treatment order. So if you look at this slide, there's all sorts of health inequalities that occur. And then I'm going to come down to actual mental health inequalities so you understand a bit more about what I'm saying. So these are the mental health specific health and racial inequalities. So African Caribbean and Black and white mixed heritage people are 3 times more likely to be admitted to a mental health ward as compared to the rest of the population. They're disproportionately subjected to what we call a community treatment order, which is like forced treatment under the Mental Health Act. The use of detention rates are higher. The BAME group seek help from mental health services at a later stage, and there's limited amounts of research. So I'll talk about some of these things later. But some people may not present because of the trauma they might have had from their personal experiences. You know, when Black people have a mental health problem, because there's this perception that they're usually quite, you know, violent, they can be physical, we get police involved. Some people, the Black people, have disproportionate use of force, restraints within mental health wards. And we've had cases where people have actually died during prone restraints within mental health wards. It shows that the disproportionate rate of death in custody, death in psychiatric inpatient units in Black people, high doses of psychotropic medication. So because of the perception that, Black people are more difficult to treat, they can be violent, there's a tendency that they're giving higher doses of psychotropic medication, which means that they have more side effects and they have more, they're potentially prone to more harm from the medications. That might be why people do not present. You know, this is another graphical representation of the disproportionate higher rates of detention in Black people. Black men are particularly vulnerable, as we know, it's everywhere in the news, but Black women are vulnerable too. So let's not use gender for this. We're talking about Black in general. And these are some of the people that I've done health campaigns with in the past. You know, so I spoke to an African Caribbean community. We sat down and we had a conversation, and I'm going to be sharing some of the things that they came up with. And some of our Caribbean colleagues and African, people in the community, they feel that there's cynicism within the Black community about structures and institutions because of their historical experience, because of their experience, they don't trust the services. For example, there's been research where Black people have come to harm. For example, the syphilis study, I don't know if we know that, where Black people were actually exposed to syphilis without treatment for a long time, even though treatment for syphilis was available, but they weren't given treatment because they were using them as experiment to see the course of the illness. So you can imagine people coming to harm because they're using them as research experience without telling them that they've actually got the illness and they're not being treated. So these might be one of the reasons why people are not coming forward to services. They don't want to be used as guinea pigs. But what are we going to do about them? I think that's why we're having the discussion today. We can't just have all this information and which affects people coming forward without us doing something about it. Obviously, racism, we can't talk about all this without racism, where Blacks, people in the past would feel that they're not allowed to speak. They were only to be seen. They were treated under so many different terrible conditions. And I've also talked about medications. This might be why people shy away from seeking mental health support, because they don't want to be overdosed or given high doses of medications that would affect them in different ways. There's also the role modeling, and some people have said, oh, Black parents don't speak about their mental health, so therefore their children mirror their behavior. So children are also not discussing their mental health problems because they don't see their parents talking about it. If you think about the generation that some older adults are from, where you deal with your problems as Black people, you get on with it. They feel that, nobody has time to deal with mental health problems. If our children get that impression, then we're not encouraging them to speak up, are we? People talk about their personal experiences of when they've tried to speak up, how they didn't get support. And then we talked about the experience that people have in schools. And I think one teacher did say that sometimes adults that are meant to listen can be dismissive, especially when it comes to Black kids. They feel they're trying to get out of doing their homework, or they're just acting out when Black children, are not conforming in school because they have mental health problems. They don't encourage them to speak up. Sometimes their self-esteem and self-confidence is affected in school as well because of the judgmental attitude they might have, because of the stereotyping. They might feel that they're just difficult children. Some of them begin to suffer in silence. So our schools are one of the places where we need to be recognizing the need to support young Black people, because if they don't get support at that stage and they suffer in silence, it can lead to grave implications for them later on. So parents can collaborate with the teachers. Experts can be invited in to train teachers, discuss topical issues with students in school. They have this PSHE curriculum now that should deal with the personal, social, health, and economic education, where mental health issues can be discussed, So it's important that schools pick up some of these things, and we as parents, what we can do to support the schools. Get in there, check what your children are doing, talk to the schools, support them, and then hopefully the outcomes will be better for our children. And, social media also matters, because there's a lot of negative information that people receive from social media. Seeing people with more positive outcome may encourage people to speak up. If all you see on the news is, people dying from mental health problems, Black people, ending their lives by suicide, dying on inpatient unit, being given too much medication, police restraining them and all that. If that's all you hear, then you're not likely going to put up your hands and say you have a mental health problem, because you don't want to be treated like that. But if there's more positive success stories, then people are encouraged to come out, And then some of the discussions we've had are about the assessment and the diagnostic tools. And because of the environment we're in, Sometimes these diagnostic tools and questionnaires have been tested out in the Caucasian and other population outside Blacks, so they're not very good at picking up mental health problems within Black people. So Black people may have low scores because they're reporting physical health problems. The language that they're using to express themselves might be different, because they might appear as angry, as not expressive, not knowing how to express their mental health problems because they're not used to doing that. And because we're not well represented in clinical trials and research, it might be difficult because we're in the Western area where we're using Western models that some people feel are not suitable for the Black population. So all that can affect people. Appearance also matters, As I said, Black people may be perceived as just being angry or, not behaving as expected. What can we do? We need to train our workforce, about unconscious bias, all this stereotyping that I talked about. We need culturally appropriate services so that the people that we're engaging with would know how to recognize mental health problems in Black people. If we're not presenting in the typical way, then we're teaching people that, look, culturally, this is how we might present. If we present like this, it doesn't mean that we're intending to harm people. That's how we talk. That's the demeanor. That's the mannerism. But it's also important that we get in there as well. So if we're saying that there are no Black therapists, we're not going to manufacture Black therapists, then we need to encourage ourselves to train to be health workers, to train to be mental health workers. Lack of Black researchers, we need to encourage ourselves to get into research. Black people should also be encouraged to pursue these career pathways. When you say that there are not enough people that understand you within the healthcare system, then let's get in there and increase the numbers available. Some of the internal problems that we have to deal with can also be the gender stereotyping. And I'm talking to us now because this is a community discussion. We're all Black people having a conversation this morning. So some of our gender stereotyping internally can affect people's ability to speak up as well. When we say, oh, Black men don't cry, Black men should toughen up, it can affect people. And guess what? The suicide rates in Black men are increasing. And don't think that they're not increasing. They are increasing. You might not hear about them because just like we are not presenting with the problems, there's also underreporting. Many Black families would keep quiet and not report suicide in their families because of the shame, the stigma that we've talked about. So when we do community engagement and talks like this, we need to remind ourselves. The other day, I did a talk with the mother of an 18-year-old boy who ended his life by suicide. They found him hanging on the back tree of their house. And because he had problems. And when the mom wanted to do a talk, somebody said to her, are you all right? You're going to go and tell everybody that your son died by suicide? You should keep quiet and don't let people know. It can affect you later. People might start looking at your family somehow. People might not want to marry from your family. People might not want to associate with you. So you can see where all this problem starts. We need to deal with the stigma within, as well as all the external problems. The stigma within also needs to be dealt with if we really have to overcome some of the things that we're talking about today. And obviously religion as well. Religion can be protective, okay? When you have a religious group that you associate with, whether you're Christian, Muslim, of different faiths, it can prevent social isolation. It can improve a sense of identification, belonging. You can pray, you can have joy, peace, everything that comes along with it. Some religions are also protective in the fact that they forbid drugs and alcohol use. All that can be protective. But when your faith prevents you from presenting, when it prevents you from taking your medication, that's where religions can be a non-protective factor. Okay, so there's a lot that we can do within our religious groups. Talk to the young children, bring ourselves together, encourage people to seek counseling, encourage people to speak up, help in different ways. There's a lot that we can do with religion to make sure that it's all positive factors. Whether you're a Christian or Muslim or Hindu, Jesus Christ in his own ministry, encouraged a lot of health healing. A lot of his ministry was about healing. He wanted us to be in good health, good mind, sound mind. So our religious leaders can support positive outcomes, okay? So if we talk about environmental factors as well, there's all sorts of factors, social inequalities, economic inequalities that can affect our mental health. Parental stress can affect attention to the needs within the home environment. There's need for self-preservation. We need to work on ourselves. There's other factors like racism. I don't think we can talk about mental health problem within the Black community without really talking about racism. We all know some of these factors. People need to work twice as hard at work to be seen as attaining the same qualification or the same outcomes. There's disproportionate disciplinary issues with people with Black people. Black people are more likely to be performance managed. They're more likely to be referred to their professional bodies like NMC, GMC. Effects of stress on your physical health can affect your mental health. When you're going through all this at work, constant complaints, constant disciplinary issues, it can affect your mental health as well. And it can cause you to be off sick from work. And that begins to lead to the economic gaps, low pay rate, lower roles. If we look at the RARE reports, workforce race equality standards, you see that Black people are more likely to be paid less. They're in the lower band jobs, even within the healthcare system. Some of these things can affect your self-esteem, your self-confidence. You've been working somewhere for 20 years, and all that happens to you is complaints. You're not promoted. You're not attaining the same career progression as people from other races. It can affect you. So within the educational system, I've come back to this again, primary school, secondary school, Black people have a higher rate of dropout from university. If we don't know this, I think it's big. We need to let you know. Black people get lower predicted grades, even at GCSE levels, which means that you've already limited the kind of universities that they can apply to. They can apply to Russell Group universities because they've been giving low predicted grades. Parents need to get in there to say, why does my child have this low predicted grade? What can we do to improve their grades, so that they can apply to good universities, good courses? There's support available in school. Ask for it. Parents, let's make sure we attend parents' evening, even in university, there's the student support systems, the DSAs. Let's reduce the dropout rates, because when Black children drop out, they're more likely to go into the criminal justice system. That's when they now start to be overrepresented within gangs and in prison, police, arrest. And once people have a criminal record, it affects their career pathway in life. So what are possible solutions? We're talking to ourselves today. I've talked about external factors. I've talked about systemic factors. I've talked about economic factors. I've talked about education, schools. There's so many factors there. But what are we saying today? What we're saying today is that what can we do about it? Rather than expecting other people to solve this problem for us. As a Black community, let's try and identify the problem. Let's try and support ourselves. I'm a consultant psychiatrist. I'm really into health campaigns that can lead to education and training of people. I'm encouraging people today, mental health research, try and participate actively. Let's go into healthcare, professions. Don't let people discourage us that we can't do it. We can do it with the right support. Let's get into our schools and educational systems, support our young ones, catch them young. Community engagement, talks like we're doing today. Input from our religious leaders and our religious institutions, organize seminars, find out who the professionals are within your environment, support each other, hold each other's hands. Let's get involved into let's get involved in health campaigns like this, speak up campaigns. Let's try and reduce the stigma and also addiction support. So being a person of faith does not mean that you could not be addicted. There's a lot that's going on that people are covering, So whatever it is that is a take-home message for you today, I'll leave it to people to decide. You've listened to a lot of things today. What are you taking home from what you've heard today? what do you think is your role and responsibility? Are you listening today and you're a teacher? Are you listening today and you're a healthcare worker? Are you listening today and you're a student? Are you listening today and you're a religious minister? Are you listening today and you're just a member of the community? What can you do to improve the mental health care and well-being for Black people? I want us to introspect and think about this today. That's why we're having a meeting today. Whatever you're going through, speak up, get help is the campaign. It's okay not to be okay. Enough of the stigma associated with not speaking up within Black people and all these, oh, strong Black woman, Black boys don't cry. I think it's really, really having a negative impact on us. We should be able to be vulnerable and speak up when we're suffering. Collaboration matters a lot. You know, some of these things we can't do alone. You can't just decide that, okay, I'm not seeking support from people or from other ethnic groups because I'm Black. No, you need allies. We need to all work together. There's the role of the government, there's the role of institutions, there's the role of, you know, our own internal support groups. We all need to work together is what I'm saying today. So thank you all very much for listening. These are my contact details. I work in Hertfordshire. I do mainstream mental health within the NHS. I also do some private practice. I work in addictions as well. And I'm happy to be contacted. Thank you for having me. Happy to take questions now. I'll stop sharing my screen.
Thank you very, very, very much, Doc. I'm not surprised. And honestly, Dr. Fafunda, I am pleased with the way you have brought this to our doorstep. What are we doing as a community? I like the way you have made us reflect on what we can do in our own niches as communities, in groups, and even in collaborating with other communities. I mean, the statistics, the figures are really alarming. 4 times more Women are 4 times more likely to die in their pregnancy and around pregnancy journey. I mean, that affects me. That's my primary constituency. I can speak to it. Why are Black women not speaking out? Why are they not being cared for? What are the gaps, the inequalities? And I really love the way you also brought in the criminal justice system. I think me doing a PhD in law and criminology, what I see every day is forced criminality, intersections of race, social strata, and just that you speak a different language with the criminal justice system, which almost acts like a hammer and nail effect. It doesn't look left, it doesn't look right. It just sends our boys, our girls to jail. And I often say
there's a differential sentencing as well. So whereas other ethnic groups can have an offense and they get a slap on their wrist, with Black people, it's straight to prison. So differential sentencing as well happens.
It's very sad. And I often say that the Black man in these communities is an endangered species. I have that opinion. You don't need to agree with me. I mean, those listening don't need to agree with me, but in my experience, in my practice, I've actually seen that. Thank you very, very much. You have a lot of questions coming into the chat. I think I'll start with the simplest one that says, what is meant by psychotropic medications?
Okay, so psychotropic medications. So I was mindful today that I was talking to a mixed group and I didn't want to be talking a lot of medical jargons. Psychotropic medications are medications that we use to treat mental health problems. We have different groups of psychotropic medications. We have antidepressants, we have mood stabilizers, we have antipsychotic medication. As the name implies, antidepressants help depression, anxiolytics help anxiety, antipsychotics help psychosis. Do you see what I mean? So we have all these mood stabilizers help stabilize your mood. You know, the people that have manic depressive, bipolar. So the general term for all these medications are psychotropic medication. But as I said in my presentation, you don't always need medication. You start to need medication when this is why you need to present early. I can't overemphasize that. Speak up, you know, speak up early, present early. You might be able to get some help before things get severe. In mental health, we categorize your symptoms as mild, moderate, and severe. When you present when the symptoms are mild to moderate, you may not even need medication, you might just need therapy. When you present at the severe end of the spectrum, then you more or less have to be admitted to hospital, you more or less have to have psychotropic medication. So that's one of the campaign, speak up early. So yeah, psychotropic medication, they're different groups and classes, but they're medications used to treat mental illness.
Thank you. Before I take the next question, I just want to appeal to all of us on this meeting. If we kindly label our devices with our names, makes it easier for people pulling questions from the chat to pull your questions and also include your name. And Doc, please, if you keep some of the answers really quite brief, because now the questions are coming in. In one of your slides, you actually said BAME groups seek help from mental health services at later stages. This was mine 2013. And you've also emphasized again on that. And I think that ties in quite importantly with a question asked by Miss T. Miss T is saying that we deal with numerous parents that have children attending schools where they are being excluded and transferred to PRUs or alternative education institutions due to their behavior, experiencing lack of support as they are still waiting for assessments. Without an official and written diagnosis, parents are unable to access the right support to help their children flourish at school, regardless of their impairments. Could you please supply a direct contact we can use to request assessment for autism and ADHD or other relevant conditions? For early intervention is paramount, just like you yourself have said. Can you please point us in the right direction? Thank you for your assistance in advance. Regards, Kim, United We Rise, UK.
Okay, so because we're in the UK now, your first port of call would always be your GP. Okay, you don't go directly to a specialist team. You don't say, oh, I've got a mental health problem, I'm going straight to a psychiatric team. We have a children's services CAMS. You can't just walk into a CAMS service, you need to be referred. So your GP is the first port of call. But again, sometimes it's who shouts the loudest. So you have people who would call the surgery every day to say, my child is still waiting for this appointment. We need to be persistent, not violent, not rude, not aggressive, zero tolerance to abuse, but be persistent in a polite way. I had I had a patient in my psychiatric clinic, and I know I need to keep this brief, but I need to explain to people. I had a patient who did not come for the appointment. First time, second time they didn't come, they were going to be discharged. Guess who turned up for the appointment? Their parents. So I offered somebody an appointment. Their parents knew he wasn't going to come. They didn't cancel the appointment. The parents turned up and said, Doc, we're here. The appointment is for our son, but we're here because we know he's not going to turn up. This is what he's experiencing. This is what is going on. And guess what we did? We went to see them at home. We attended a home visit. So I talked to many Black folks, and they're like, oh, he's going to refuse to go. He's not going to answer. Nobody else does that. He's going to refuse to go. Book the appointment. Go yourself. I am the mother. My son has this problem. He's not going to come, I know, but I've come to tell you that he has this problem. I learned that. I even used that. My daughter had an appointment. She wasn't going to be around. If my patient's mother could come to my own appointment, why can't I go to my daughter's appointment? I did that, and it worked for my daughter as well. So these are some of the things, learning points that you pick up along the line. Be persistent in your request, present early. You knew that the child had a problem from age 5. You did not seek help 5, 6, 7, 8, 9. They now want to write secondary school exam. That's when you're seeking support and they're being delayed. That's why I said internal, we'll solve the problem internally as well as externally. So be persistent in your approach.
Be persistent in your approach. Seek help. Seek second opinion. Utilize people like us in your communities. Sometimes I've had to call NHS hospitals just on behalf of people in our communities. So let's speak out, be persistent. The next question is a very interesting one. It says, how would you advise we speak to our children if we suspect they have been inappropriately touched or sexually abused? And even more importantly, how can we prepare our children to be able to open up themselves when they've open up and speak themselves when they've been taken advantage of sexually?
Okay,
How do
so
you initiate those conversations?
yes. So sometimes it might be difficult for children to open up to their parents. So we can't deny that, obviously. And sometimes it's the approach of the parents as well, because they feel that you're going to be negative or you're not going to believe them. I have to be objective, remember. So, sometimes our generation, we might be harsh. We might not believe in mental illness. We might say, look, I spent so much on you, you're a disappointment. You're doing this to the family, you're a disgrace, I'm going to disown you. When you said all those things to your child when they've had a small problem, when they have the big problem, do you think they're going to come to you? No, they're not. So again, our approach matters. And if they don't see you expressing your own emotions, if you're always blank face, remember what I said about generational, not speaking, sealed lips kind of thing. You're the strong person, and you've never been vulnerable, you've never told them, oh God, I feel low today. So they don't even know that you have emotions. So sometimes they might not feel free to talk to you. So we have to create the enabling environment. This is why we're having this conversation today. So we go to church all the time. Yes, arrange Bible study, arrange, this and that, but also arrange support groups for the children to speak to people. It might be auntie this or uncle that they're able to talk to. Talk to their teachers, to say, look, this is what I've noticed at home. My child is no longer blah, blah, blah. Go and talk to their teachers in confidence. The school have counselors. You don't know that. Secondary school have counselors. Primary school have counselors. University have counselors. Go and make an appointment with the GP.
All right.
No, so don't keep quiet. The problem is that we keep quiet and we say, oh, we don't know what to do.
So let's start speaking, and let's speak in the house. Let's speak in the families. Let's speak to our children. And because I'm someone who is very, very involved in reproductive health and all of that, I want to put it out there today. Black parents, from a very early age, you need to start building the self-esteem, not just the self-confidence, the self-esteem of your children. And part of this is actually even discussing with them their growing anatomy. Don't leave that conversation for someone else, because if you do, then they're not going to come to you like Dr. Fapohunda has said. So have those conversations. My father had those conversations with me. Okay, oh, what's your period like? Is it heavy? Is it light? Initiate these conversations. You just have to have them. Then someone is making a comment, Doc, saying, this is Karen Hutchinson. You are describing the same as it was 30 years plus ago. Karen Hutchinson believes that we have moved on. And she's saying at least you should be able to mention some of the positive change we as Black, African, Caribbean societies have also made. Is there one or two you can describe while I move on to the
next? Of course, the fact that we're having a conversation like this, come on, we never had conversations like this previously. Karen, you've hit the nail on the head. Karen should be given a big thumbs up. There are lots and lots, even professionally. So I am a member of an association that's called Association of Black Psychiatrists UK. There's Association of Black Therapists. Come on, we've come leaps and bounds. There's a lot that's going on, there's support, there's a lot out there, but we can't afford to rest on our laurels. We just have to keep these conversations going. So yes, a lot of progress has been made, but we need to keep at it.
Thank you, Karen. Thank you, Dr. Fapohunda. And Karen has gone to buttress this as well. A group set up by a man whose son died, encouraging men to talk about grief and not pretend that they are superhuman African men who don't grieve, who have no emotions. Thank you very much, Karen. Again, you have a lot of positive feedback here, Dr. Fapohunda. Zana is saying that listening to your talk, she now believes we have more power than we think. We are the people. So that is a good one. Then there's another question which Ruth has sent to me. Just a moment. Could you share information on Black autism support groups, please? We have parents that are willing to be trained to support children and parents with children that have missed out on their educational needs due to lack of support and lack of diagnosis. So that's related to the first question you have answered.
Yeah, so Google is your friend. There's a lot going on online. You know, or you can go to your local, town center. You can go walk into your GP surgery. We don't know the amount of information that's out there. You can say, I fear my son has this. Can you signpost me?
Honestly, I want to use a real life example. I fear that as a community, Dr. Fapohunda, that we do not utilize our GPs enough. Because we are Africans, we respect power gradients. But I want us today, after being empowered with all this information, to know that your GP is your friend. They have every information about you, and they will release you to all of the help services you will get. So parents, start off point, Dr. Fapohunda has said it is your GP. If they turn you away, go again, go again, go again, and go again. And sometimes you can go with a friend. You can go with someone knowledgeable in the field. I've had to take days off just to see our people to a GP surgery and speak to the GP. I introduce myself, tell them who I am, and say, look, this is this, and this. Because they do it to me as well. Patients come to me with their friends who are gynecologists. So if they can come to me, why can't I go with my people? So please, let's do that. And Adeze is asking you, Doc, she's saying, my question is, how can international students, especially Africans, get support without the kind of fear I had? I think she's asked an earlier question.
I think she felt because she's an international student and she didn't want speaking up about her mental health to affect her visa. No, that's Equality Act. It's going to be at her detriment. And I'll give you practical examples. Sometimes we talked about different reasons why people don't put up their hands to say that they've got mental health problems. Some of it is some people fear it going on your records. Because sometimes when you want to apply for...
To interrupt, but can I just take Adeze's question so that it's holistic?
Okay.
She first asked, she said, I'm a student and was once depressed within last year. Thank you for sharing your private conversations and experiences with us. Thank you very much. I was scared to speak out in school for support because I was on student visa and fear my visa would be revoked. Excellent. Okay. So go on.
So the first thing to say is that your visa would never be revoked because you've got depression. Okay? If anything, if you don't speak up about having depression and you don't do well in school and you end up dropping out, is when your visa can be revoked. Because if you drop out and you're no longer a student and you're on a student visa, then you can't renew it because you've dropped out of school. Remember, I said dropping out of school is higher disproportionately with Black people as well. So they're different. So there's always a DSA, Student Disability Support Group. You have your course tutor. There's the Equality Act. Nobody should discriminate against you because you've got a mental illness. However, I've seen people who genuinely said they would rather go private or they would rather go and get treatment abroad because they don't want their records to show that they have a mental illness. Because even for things like getting an insurance, if you want to do life insurance, they ask you, do you have this? Do you have that? Have you ever had headache? Have you ever not slept for 2 days? Have you ever? The question sometimes, and once you tick yes to anxiety, to depression, then it might make your premium higher. And that's true. And sometimes when you're applying for jobs and they say, do you have a history of depression? Have you ever taken time off work? Have you ever been sick? What's your sickness record? You would think that such things should not affect you, but sadly, some employers still would discriminate against people, which is against the law, which is not lawful. That's why some people may not want their medical records to show that they have a mental health problem. So remember I talked about institutional problems, systemic factors. These are factors that are beyond our control. And I recognize that. So when I do my talk, I do factors that we can control. What you can control is speak up, get support, put yourself in a state where you can finish your education, you can start working rather than dropping out. Some of these institutional, systemic, environmental factors are really beyond our control. But talk to somebody about it. You know, I'm glad you got well, Adeze, from your depression. But in the future, if anyone is depressed, please speak up. Grab the next person and tell them. The next person, grab the next person, grab the next person, and collaboratively, we can begin to look after our mental health together.
Fantastic. And just to buttress what you said, Zana has said to everyone, she said, biblical diet, eat in season, seasonal fruits or veg, fast when you can, cycle, walk to shops, parks, drink lots of water, 1 liter a day at least, play board games, listen to calypso, reggae music, gospel, whatever you like, Afrobeat, uplifting music. And then she puts one thing which we don't really like doing. She said volunteer, volunteer and volunteer. I think in our
Yeah,
communities, we don't understand the power of volunteering. It
yeah,
brings so much joy, releases endorphins, and makes you feel very at peace with yourself, and you are doing good for other people. And then she adds plenty of rest can help manage our mental health status. Thank
yeah.
you very much, Sana. Shade Ado has said to everybody, please reach out to the speaker. I can assure you she shall be ready to help. If in Buckinghamshire, you can reach out to me and we'll link you up to Mosun. She has given her details, so please note her details.
Yeah, she's a counselor. She's one of our Black counselors.
Fantastic.
A very good friend and sister. So yes, you can. And she, in all honesty, they arrange a lot of programs as well. Our community centers, our local counselors, you know, there's lots of programs. But do we attend? Do we attend is the problem. When we see all these flyers, because they're time consuming, people would think, oh, 1 hour on a Saturday morning to join Zoom. No, I've got to rush around. I've got to go and pick this and this. And remember economic factors as well. So will I tell somebody to cancel their shift this morning to come and attend the mental health talk? Am I going to give them money? They have bills to pay. They might have debts. They might have children. This is how social economic factors can affect us as well, disproportionate. During COVID, we have people who should have been shielding, who had diabetes, hypertension, they had physical health problems. They couldn't shield because they needed the money. And then, you know, COVID affected people. So this is so intersectionality. This is
In
so
fact, I
intertwined.
love this fact you brought in, this intersectionality, because it also ties in with what Zana has put on this group chat now.
Yeah.
She said, join Parent Teacher Association, PTA, or become a school governor, attend parents' evenings, sports day assemblies, let the teachers know you exist, know their names. And you, Dr. Fapohunda, when you were speaking, you said parents need to collaborate with teachers. We as parents must think of what we can do to help our children. Even you went on to say we need to help them to navigate the social media space. So again, it's coming back to the home front. It's coming back to us. We are not going to be able to just contract our own duties away as a community and as the family, which is the primary unit of society. So all those extra shifts we are taking, sometimes we need to ask ourselves, what choices are we making? Can we stay at home today and watch a film with our son, with our daughter, with our children? Or do we really need to take that shift? Because there are some things money cannot buy.
Absolutely.
I'm just checking. Ruth, have I taken all the questions? I don't want to miss anything. Is there anything from Facebook?
No, we haven't got anything on Facebook or YouTube at the moment. So if anyone wants to feel free to drop.
Somebody asks, is there any funding available to help us, please? I think those are questions that can be taken out of this chat right now and can be asked of the organizers and the person who is speaking today at a later time. And Ruth, you may be the one to answer this. Can we access the recording at a different time and where? You can talk about that later. But there's something Ruth has put in the group chat, which I think Dr. Mosun, you may need to speak about. Student disability support groups. Do they exist?
Oh, they do. They do. And how do I know? Because people come to me and say, can I provide a support letter? I'm like, really? So it's DSA. Um, DSA. There's all sorts of support available within the university system. Please, when your child is going into university, don't wait until they've got an issue. Know the support system. There's student welfare. There's all sorts of associations. Even the universities have African Caribbean Association. They have societies, that are there to support you. The problem is we don't join the societies. It's like you have an association. You don't join. Then when there's a problem, is when you run there and say, oh, I've got this problem. Let's be open-minded. Let's join them. There's a lot. Nobody's going to come and give you all the information you need in this world. Read, research, read. There's a problem that you have. I have a problem with this. How do I get support? Google is your friend. I do that as well. Check what's available to you.
Yeah. We are pressed for time, but there is one thing I really want us to address, and it's in the chat. Bibi has asked a question. She says, I really would have liked to hear about mental health being triggered by bereavement and by migration. And as someone who is working on illegal and legal migration, I will have a word on this. But please, Dr. Fapohunda, speak about this. It's very important.
Okay, so I'm glad you asked that question. There's only so much I can deal with within the hour. Bereavement is very important. And I think I touched about it on one of my slides, but I didn't expatiate. We have bereavement counseling support. There's CRUISE in the UK. However, the background of Black people, there's no bereavement support. People don't even know that it exists. So, for example, somebody dies and people come and visit you. First day, second day, first week, they come and visit you. The next thing is, what's the date of the burial? What ashwabi are we going to wear? What's the color? Who's the musician that's going to play? Do you have a caterer that's going to serve the food? Do you have, people don't, that's where the conversation goes after a while. Like, oh, he lived a good life, blessed is the memory of the departed. Of course, blessed is the memory. But what about the person that's suffering that loss? What support do they get? So I want to say to you today, there's bereavement counseling. It's not common, it's not often talked about in our society, but please, if that's one of your take-home messages today, remember I put a slide on take-home messages, bereavement, and also migration is a big trigger. People often have to downscale. Like, you'd have been working in the bank, you were a bank manager, you come here and you have to down because you have to do care job, or there's a lot of abuse, relationship problems with marriages, divorce that happens because the husband says, oh, you were the one that told me to come, I was doing well in my country. The wife says, you were the one that told me to come. Ends can't meet. They don't see each other. They're doing 10 shifts, 3 jobs. Before you know it, conflict, abuse, people have even killed each other, homicide. So please, immigration it can cause depression, social isolation. You're missing the family. You've got 4 children. When you were in Nigeria, you had a driver, you had a cook, you had house help, you had this and this and that. All of a sudden, you have to do all the responsibility. Men, women, we never got involved in the children because we had all those layers of support. When you get here, things can be difficult. Money can be tight. Professionally, you might downgrade, you might miss your career, you might miss your family, friends. There's a lot. All that can affect your mental health, and we see them all the time. Please, 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 there are important factors that can affect your mental health. And when somebody comes to your church, to your mosque, to your society for the first time, don't say, oh, you're new to the area, we have this meeting, we have this Bible study, we have this women's meeting, men's group. Can you please ask them how they're doing? Maybe that's all they need to hear. So there's a lot that we can do within us as well. So I'm happy we're having all these conversations.
Yeah, honestly, I want to say there are a lot of messages in the chat saying well done for all you've said and touched on today. I just don't want to start reading them individually because we're pressed for time. But for everybody who has actually said thank you, we also say thank you to all of you. All of us say thank you. You see, with respect to migration, I think we must understand that there's something called cultural shock when an individual moves from any path that they are used to where they are not used to. So when you move from your source country to a host country, there's a cultural shock. For me, coming into the United Kingdom, I first went to Scotland, and I can tell you, I did not understand a word of what was being said for the first 6 months.
And yes, you
Because,
had to treat people.
yes, they speak at low decibel. I'm a Nigerian. We speak at very high decibel. So I couldn't hear. And then the language was a bit different. The English I learned in Nigeria, you tell me you are having dinner at 2 p.m. I'm like, what? Dinner is in the evening. So there's a lot of cultural shift. But what I want to appeal to us is that when you're a legal migrant or an illegal migrant, we must apply ourselves, and we must actually do what I call cultural integration for the sake of our mental health. You mustn't be resistant and stay at the end of the spectrum, not wanting to integrate. You must understand that when a white or Caucasian person offers you a cup of tea, it's their own entry point, their own way of saying, I care about you. I want to get to know you. Don't just keep refusing all the offer to have tea. Even though you don't want to drink that tea, go there, sit with them, hold that cup. You can go to the sink later and pour it away. It's okay, as long as I don't see it. But I'm just trying to get us to understand that we need to integrate, and it needs to come from us. So we don't want to take much more of your time. Your last words, Dr. Mosun Fapohunda.
Thank you
Or
all.
Unibe.
Thank you all so much for coming, because without you, it wouldn't have been a conversation. It wouldn't have been possible for myself or Dr. Loretta to talk to ourselves. I want to thank Khan for organizing this, and well done for all that you do. And yes, we've made a lot of progress. We just need to keep at it. Remember, speak up. Your mental health matters. Thank you.
Keep speaking. Speak up, speak up, speak up. Don't let stigma zip our lips. We're Africans. We're proud. We can be anywhere in the world. Well done to Khan. Well done to the organizers. Well done to those who work hard every Saturday. Thank you very much.
Thank you.
Thank you so much. Wow, that was an amazing session. Thank you so much, Dr. Mosun and Dr. Loretta. It was, I just kept nodding and nodding and nodding that we need to hear more of this in our community. So thank you for that very, very reflective session on the gaps within our community and how we must take responsibility about our own mental health. So thank you so much. We really, really appreciate your time. And we're happy to have you back again. Yes, we want to hear more of it. So thank you so much, everyone, for joining to this point. I'm sure we had a very great time on the session. So just before we end the session, I'm going to quickly run through the other amazing things that we do here at SCAN and other opportunities. So I'm just going to share my screen. Give me a minute. Can we see my screen, please?
Yes, we can.
Okay, thank you. Yeah. So thank you once again. Well, just as we've had it today, this time next week we're going to be here again. The same time at 11 a.m. We're going to be bringing to you another interesting, conversation that we should have in our community. Like we know, this month is the breast cancer, awareness month. So we're going to be talking to you about everything you need to know about breast cancer. We'll have our lovely doctor, Dr. Vaughn, who'll be sharing insights on all you need to know about breast cancer and the actions we need to take as individuals, in our families, in our circle, to reduce the mortality rate in our community. So you're invited, stay tuned, and we'll always send reminders in our groups. Next on, as we speak, we have the pink party going on. So like we said, we want to empower our community to fight against breast cancer. So we have the pink party happening now from 11 to 3 p.m. at Gorton Shore Start Sacred Hearts. There down in Gorton. You're going to be hearing life transforming stories of survivors, breast cancer survivors. We're going to raise awareness. We're going to have practical sessions with dummies, on how to carry out self-examination, because we need to know these things so that we can, help ourselves, help our loved ones, for husbands, help your wife, to check that they take these things early enough, and also to raise awareness of the screening as well that go on. So it's happening here. So the dress code for today is a touch of pink. So after here, we're going to be heading down to Gotten to join the pink party. So still at Gotten Sacred Heart Family Hub, we have the Caribbean and African Cultural Wellbeing Hub. So yeah, this is a CAN hub where we provide wholesome support, like we said, about our mental health. So we have perinatal infants mental health support, which is culturally tailored, to help Black women and families across Greater Manchester. So this hub runs every first and third Saturday of the month. So please tell anyone that you think needs such community, come and be a part of this community and spread the word. We also have research. We found out that when you involve in research as a Black person, you help to increase the health system, even here in the UK. So this is another opportunity. It's called DCYPHR. It means DNA, Children plus Young People's Health Resource. So this is, you can help to inform new treatments for millions of people by helping researchers to unlock the potentials that lie in your DNA. So we're calling out to people of ages, children, youths from 0 to 15, to help researchers understand, things concerning their mental health, how to combat diabetes. All you need to do is to spit into a tube. So yeah, so if you want more information on how to get involved, please reach out to us as research@can.org.uk. I'm sure in the chats we'll also have further information if you want to know more about this. And yes, we have this amazing Greater Manchester Black History Month calendar. So we know that we are in the Black History Month. We're celebrating Black history, and we have a number of events happening across the UK, really. And so this calendar of events is to majorly to celebrate and explore the rich heritage and significant contribution of the Black community, of our Black people in the UK, in our community as well. So we are delighted to present this. It's commissioned by the Mayor of Greater Manchester and Greater Manchester Combined Authority. So please help spread the word. It's like I said, it showcases events happening across the 10 localities of Greater Manchester and the rest of the UK, really. So it offers opportunity for you to connect, network, celebrate, and honor our Black contribution. So if you want any inquiry into this, please check on our website or reach out to us on bhm@can.org.uk. So lastly, like we talk about mental health today. We cannot talk about it enough. It's deep. It's, the impact it shows on individuals, on families. So we will keep talking about it. And just to let you know that here at CAN, we offer Black-led professional counseling service. So it's available all week round. Like we've heard today, you need to speak to someone, you need to share. There is help out there. So do not remain quiet. So speak up. There is help, and you don't have to face it alone, really. So contact us. You can email us at counseling@can.org.uk. There's also an opportunity available for trained counselors. So we have opportunities for you to join the counseling team, give back to the community. So if you want further information, please contact us at counseling@can.org.uk, and we'll walk you through. So thank you so much for joining. Is someone saying something? Okay, so thank you so much for joining, and we hope to see you all next week. Thank you, and see you at the pink party. Bye.
Welcome to our Caribbean and African Targeted Health Improvement Program, CATHIP Health Hour. The Caribbean and African Health Network, CAN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@can.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.